Welcome to Beyond the Press Release, a production of Agoracom in which we take the time to speak with small cap executives after they put out important news. With us today, happy to have him for the first time ever, Andrew Morton. He's CEO of Maitri Health Technologies. The company trades on the CSE under the stock symbol MTEC, and for our friends in Europe on Frankfurt under D84. A little bit about the company, because a lot of you are hearing about this for the first time, especially from the Agoracom side. Here's what you need to know to understand Maitri and why it's so powerful. When COVID hit 12 months ago, there was no supply chain in place to handle what you can only call the parabolic surge of demand for PPE. That's personal protective equipment. We know that as masks, shields, tests, and so on. So an industry literally overnight of brokers was spawned to fill the demand of buyers who were, for lack of a better term, desperate and scrambling for product. As you can imagine, that created some real issues with respect to sources, quality of supply, and in many instances, outright fraud. For example, in Canada, we saw numerous news reports that highlighted how healthcare workers and businesses were shortchanged on orders internationally, or worse, they were shipped counterfeit, uncertified N95 masks that put people at great risk of exposure and illness. It became a problem. Maitri is solving that problem. They're a global platform for healthcare supply security. Their main focus is providing a reliable source of certified PPE and testing solutions through an onshore manufacturing model. More than that, they've incorporated technology, solutions. They're doing great stuff. Andrew, welcome to the show.
Great to be here, George. Thank you.
Hey, so the press release you guys put out yesterday that we're going to talk about is Maitri announces Health Canada approval of domestically manufactured N95 masks. We're going to talk about that as the Beyond the Press release. But first, before we get into specifics, how big of a problem are you solving?
This is a problem of epic proportions. When I got into this business, I came out of an industry, consumer electronics, where we were well organized. We had great protocols. Now, it's heavy on the offshoring model, of course, because everything's made in China, let's face it, and there's nothing wrong with things being made in China. But what I found out when I started looking at this and we started crafting our business was that as we peeled it back, there was a giant imaginary wall between all of the buyers being healthcare and the producers being offshore. And that's everywhere in Asia Pacific. And that's not just China, that's Malaysia, Vietnam, Taiwan.
Sure.
But the problem was there was an absolutely zero visibility in where things were coming from. So when a doctor would open a simple package of masks, they wouldn't know where it came from, when it was made, or even have any kind of certification if it was actually legitimate. So that was all fine for the last 3 decades, but then COVID hits. And unfortunately, this, what we'll call a buyer's market, where all of those folks offshore were basically selling products as commodity to the, to
anything and anything.
100%. Overnight, it was absolutely amazing what happened. Overnight, this went to a seller's market, which suddenly evolved into a brokerage market. So all kinds of dark individuals moved into this business very quickly that had really no business being in healthcare. And they were essentially brokering with public safety. And this was immediate. I was sitting in my home office, the beginning of all of this, watching CNN, and we saw the governor of New York, Andrew Cuomo, doing an open call to anybody and anyone that could possibly supply the state of New York masks. And the first thing I thought was, oh my goodness, he's just opened up Pandora's box. He has no idea what he's just done to himself.
I had people calling me up and saying, hey, George, we want to sell N95 masks. Can you advertise them on Agoracom? Can you call all your clients? And one of the first things I asked was, well, where are these masks coming from? How do I know they even work? I don't want to, and nobody can answer those questions. So right away, and not that we're going to sell masks, all that, but right away, when I saw people calling me saying, why would you call me? And you can't even tell them where they're coming from. So you're definitely solving a major problem. Big picture, how are you guys doing it? We'll get into the details later, but big picture, when you're talking to hospitals and Georgecom and all these companies and healthcare enterprises, how are you guys solving their problem?
The way we're solving a problem is 2 ways. One is to show security of where it's coming from, bring things on shore. If you look at what happened the last 12 months in our business, it exposed the weaknesses in our supply chains and the weaknesses in the buyers and sellers' sophistication to do it. And what we did is we solved it by building stuff domestically. So we actually established through a really solid partnership, masks, shields, hand sanitizers, disinfectants, test kits, and all of that we brought onshore. So there's security around that. But the bigger piece to that is that the buyers, the users of these now know where they're coming from. And then we now have digital ways to prove where it came from, when it was made, and if they're actually certified. So that surety has been added to this. You know, a good example as an analogy is if you have an iPhone and it goes defective, you have that, and you bring it over to the iStore, they'll tell you right away when it was made, who was working in the line, all of it.
Right.
That's all an ISO standard. Healthcare didn't have that before this. We're bringing that standard to this. But the other part of it is, if you look at the common mask, you know, it's a very good example. That design hasn't changed in 150 years. So there was a need to modernize all of this, not just the systems, but the materials themselves. And the idea is to why not build a better mask? Why not make a better shield? Why not have superior hand sanitizer? It doesn't hurt your hands when you use it. And it seems like basic stuff, but the reaction is fantastic. You know, and the customers that start buying, they don't stop buying because their attitude is, well, first of all, I can trust where this is coming from, so I'm giving this to my staff, and they're safe. But this is actually just a better thing to wear. It doesn't wear out the same way.
And that's the part. So since we're talking about that, let's go down, you know, that rabbit hole for a second. I've seen some of the products. I love them because you guys aren't just sourcing masks from Georgecom Masks and, you know, securing the supply and brokering it. You guys are actually coming up with some pretty great products. Talk to us about two products. One is the mask. How did you guys change? It's almost like a 3D mask, which is amazing. And then the second one, if we're able to talk about, is you're incorporating technology to things like face shields and so on and so forth. I'm not sure if you're able to talk about that, but talk to us about some of the innovation you've brought to the space, which is amazing.
Absolutely. With our partner that's helped us design this, this is a good example of a mask, and I didn't want to plug product. It's not the Home Shopping Network, but I'm very proud of this. And this is a black version of it. Of course, it comes in white because healthcare likes white. But if you look at this, the face doesn't touch it, so you don't get that condensation. So the actual mask itself lasts longer.
So it actually kind of protects, but comes out a little bit because it's in black, so it's hard to see. But it actually comes right. Got it. Because that's a big problem. My son just took a flight and he had to wear a mask. And he's a teenager and he was on his face the whole time. And he had a breakout after being on the plane for 3-4 hours. Right. And I'm sure for people working day in, day out, that's a major problem. You guys have innovated that.
Healthcare protocols actually dictate that you should change your surgical mask in a hospital setting every 4 hours. Between the condensation that kills the filtration, and then also just the actual bacteria that forms inside. Because when you're exhaling, you're actually creating bacteria inside from your own mouth.
Sure.
Mold, there's a danger of spores and all kinds of stuff that can happen. They're supposed to change it every 4 hours. So this now extends the life of a mask, just a common mask. You know, I see a lot of these reusable masks, and I think it's really important to consider ourselves environmentally friendly as a society. I think we've come a long way since just throwing stuff away.
Masks are the new cigarettes. When I was growing up, you don't see as much anymore, but you see cigarettes everywhere. Now you're seeing masks everywhere on the streets and on the roads.
The challenge with the cloth mask is if you're using it every day, day in, day out, and never cleaning it, well, then there's that same danger of bacteria. So that's a problem. Plus the filtration. This is actually and there's true filtration. This is an ASTM, what they call ASTM level 3, which is a surgical grade mask. So this would be safe for surgery. The idea behind the recycling is that because of the way the layers work, we're actually working on a program for recycling masks. So we can take not only our own masks back, but somebody else's too. And we're actually working on trade-in programs for hospitals and healthcare regions. So the idea is, as we ship them masks, we take back the old stuff and we responsibly dispose of it. And there's some interesting processes to do it. And we found a way to do it emission-free, and some of the materials can be reused.
Are you also able to talk about some innovations? And if you can't say, hey, George, for now we can't, but in what you're doing with the shields and sensors, or is that something you're keeping under wraps for now?
A little bit under the wraps. What I will say is, total workplace safety goes well beyond just PPE, which is, you need good PPE, but it's all about managing workers and how they work together. There's been some reports in Canada, so it's a really good example. Cargill in Alberta was publicly noted, had a potential for a criminal case that was being filed, and I'm not sure where that is in the courts, and I can't comment any further than that. I've just seen the news on it like everybody else. But there's talk of a criminal case because a couple of workers died as a result of transmission of COVID on the line. And if you've ever been in a meatpacking plant, it's a really good example. The only way to do it is you've got people packed together.
Yeah,
you have some means of managing those people, and you use PPE as a digital collection device. In other words, a way to pull up vitals, sensors, and that kind of thing, and vitals. And maybe I'm giving away too much of what's coming. But the whole idea is that you're now managing outcomes and predicting things before they happen and before they can become a problem. And at the very least, at some point, the employer can turn to insurance companies, federal authorities, anybody else, and say, here's all the safety we're following. Here's the health and welfare of my workers. Here's my report.
So that's the technology side of Maitri Health Technologies.
That's correct. So you may have seen a press release a couple weeks ago with Loop Insights, where we're licensing some software.
Yeah, I want to bring that up.
Yeah, there'll be there's more to come around all of that, and we're getting really excited to announce what we're doing there. But the idea is that's going to be a component in a broader technical strategy around getting general workplace safety to get people back to work and keep them there safe long term. And a couple of key things are happening in this world. The Canadian government, the American government, and probably the European Union are all going to drive some kind of regulation. From what we're hearing, the Americans have certainly made the most announcements about it the earliest. Back in January 25th, I believe, President Biden announced that there's going to be some accountability for the workplace for safety and health. Well, this doesn't go away. 5 years from now, when I'm hoping COVID is behind us, what comes next is prevention to keep this happening again to us, because we can't afford to have industry shut down. So the Loop and what that announcement's about is some components there which we really like, which is their wallet pass, which they've announced a number of times, becomes that passport for you to get to work. And the whole idea is, you got a worker that they know if their environment is safe, so they feel safe going there. But then the organization also knows who's supposed to be there and who isn't.
So this would be the first solution that actually incorporates everything from wallet pass tracing all the way to the product at the end of the day. That is there anybody out there who's got this all-encompassing solution like that?
I would say we're the first one. As far as I'm aware, nobody else has thought of it this way. Somebody said to me, because of the neat designs we have, we're kind of like a consumer electronics company, almost like an Apple or a Google of PPE, because it's so cool looking. I look at it very differently.
You have Appleized these products. I mean, it's amazing. I want that mask, by the way.
Well, what makes it, I come from a technical background. What makes it cool to me is not just that it's a cool looking product and it feels great and all the things you'd expect, but more than that, it's part of a bigger strategy around providing better outcomes. When you consider what smartphone is all about, it's more about all the services wrapped around it than it is the hardware itself. Why wouldn't PPE be viewed the same way?
Everything's viewed that's exactly right. And you know what? That I call that when people walk into an industry. So long before you came along, I don't want people to think I'm, cheerleading you guys, but I've said that's an industry that needs to be Appleized. That's an industry that needs to be Appleized, which means somebody come in and completely reinvent the products and freshen them up and make them better and make them, much more effective. And that's what you guys are doing. Let me ask you a question. Business model now. Okay, so devil's advocate, great products, great supply chain solutions, all of that technology being built in. How do you get distribution? How do you market? Because at the end of the day, you still have to get to GeorgeCom and ABC Healthcare and XYZ hospitals. That's no easy task. How are you guys getting distribution, or at least how are you marketing Maitri?
Great question. We actually have set up distributors in the US and sales channels in the US, Canada, Mexico, which we just announced, and UK. We've actually also added resources to all of those. But on the materials, strictly the materials side, it's pretty obvious who our customer is. Our customer is the healthcare regions, the larger government authorities. So if you look in Canada, there's essentially 13 different regions if you add up the territories and the 10 provinces. So to me, that's quite clear. The federal government, looks at things at a bigger level, but really the real interesting things happen at the provincial level, where the general needs happen to be for public health care.
Of course.
If you go over to Europe, each country, socialized medicine, so you understand where the distribution models are there. And then the US, what you have is major healthcare systems. And Mexico is somewhat of a mix of, we'll call it public healthcare and a lot of private healthcare. So a nice mix. But the more interesting part of this is the business community. Because what's happened now, George, is that businesses are becoming as much a healthcare provider as any of the places I just mentioned. Because long term, if I were in the fortunate position of managing 100,000 employees at an airline or something, well, now I'm thinking about the health and welfare of everybody that works there.
Because it could take down your entire business, right? You could
100%.
You could lose staff. You could, when I mean lose staff, not the they might get sick. They have to stay home. You might get customers sick, causes goodwill problems, right? When people find out that George Airlines had 6 of their passengers get sick. So you're right. So before businesses would say, oh, if you get sick, go to the hospital, or, now they've got to be the provider on the before, right?
Disruption to their business, just flat out. When you drive across the Lionsgate Bridge out here in Vancouver, near where our office is every day, I can see container ships sitting in English Bay. Now I know, coming from the shipping world, because what I came out of was mass production offshore, so I understand how containers work. Those are not supposed to be sitting there. So that gives me an indication that somewhere along that chain, something's broken, because generally container ships go in first, which tells me the supply chain has been broken. That is a result of some kind of outbreak, some kind of exposure, some kind of shutdown. Same thing's happening in the food industry. We keep seeing this. This hasn't stopped. We had Tyson's Foods in the U.S. has announced shutdowns. Cargill, of course, here in Canada has announced shutdowns, and this continues to happen. The only way to avoid this is to look at your organization really really as a healthcare provider. And big companies are now telling us that we're doing business with that for the first time ever, they had to go out and recruit a chief medical officer.
Isn't that something? And how are you getting to these businesses? So I get how you get into the healthcare, because you're right. Healthcare in the US, you can target, who to target. Healthcare in Canada's 13 provinces, essentially, or provinces and territories. How do you get to GeorgeCom? How do you get to ABC Widgets?
We're building a world-class sales team that understands large corporate, because part of that, what happens is longer term, it's not just a PPE sale for us, which is just a component of where we're going with our business, but there's an entire digital component to keep that place safe. And the people that we're recruiting and bringing onto our team are more about systems and understanding workflows and how companies run, because then they understand how to help them really consult with them, really as that chief medical officer as a service, to help them figure out how to organize their people, where they should be wearing PPE. Maybe 5 years from now, we can teach people digitally with, using artificial intelligence, how much PPE they don't need to buy. But then we get to stay as a supplier for the long term. And when this is all over, when everybody's touching wood, we really hope with the variants and everything else that we're hearing about, at the very least, the vaccines help us contain it. The reality is that this pandemic turns to an endemic. In 5-10 years from now, what's going to remain after what I call a 9/11 event, which is this pandemic, is all of our patterns change. The way you and I go to the office every day completely changes. So we now recruited a sales team to address the real long-term needs of the business, not just here's a bunch of masks and shields and that kind of thing. Because that's a. And
I'm glad you bring that up, because because there are going to be people out there going to say, well, Andrew, Maitri won't have much use much longer because vaccines are the panacea. What are you hearing actually? I know what I'm hearing, but I want to ask you first, what are you hearing on the ground from business and enterprise?
What I'm hearing is long-term, this doesn't change for them to maintain operations. And here's the way I see it. These lockdowns we've had, especially at the beginning, we had to have lockdowns in Canada, US, and everywhere, because frankly, we just didn't know what we were dealing with. And they continue to happen. Unfortunately, the side effect of that is that a lot of businesses are really suffering from the lockdowns. But then, like a binge diet, when the lockdown is over, the person goes back to kind of their normal behaviors. And the problem is, just like if you've ever known somebody on a binge diet, they lose 10, 15 kilos. But then 30 days after the binge diet is over, they generally have put all the weight back on, right? And half the time they've gained a few to boot. Look at our lockdowns. Look what happened. In Canada, in every province, we had our initial lockdown. We came out of it. The numbers were great. And then the next wave came, and it was way worse than the first one. So the only way to do this is to lean into the problem, if you ask me. Which if you create protocols like a Swiss cheese, you kind of stack the pieces together, and you start to cover the holes with more masks, disinfectants, sanitizers, where you're disinfecting everything around the areas, and then you add some intelligence and some software to it, so behaviors are now managed. Well, each one of those is a screening mechanism for transmission. So this is a long-term way to get people back to work and keep them there versus, okay, shut everything down. Okay, now open it again. That doesn't seem to work. What seems to work is long-term protocols.
I'm hearing the same thing from business. They're saying that business, big real estate owners of big buildings who are telling me vaccines or not, everyone hoping vaccines will at least contain it. Like you said, and it's not going to get rid of it. Vaccine is going to contain it. But they've all gone through such disruption. They just can't afford any more disruption. They can't just take a chance and just open and hope for the best. So for the next 12 months, 24 months, they're absolutely going to have these protocols in place. The second part is everyone is now very well aware of the fact that this could happen again, God forbid, but that's a fact, right? I mean, we've already had just in the last 20 years, swine flu and so on and so forth. So it seems like it's now becoming part of the business, just part of the big cost of doing business for all major enterprises who are saying, we can't afford for this to happen 3 years from now, 4 years from now, 6 years from now, and we are shut down again because we took such a big hit now. If we take another big hit, that might finish us off forever. So it's the demand for Maitri's products, the sources of product, the technology solutions, that's going to be around for a while from what I get.
So one of our advisors is at Yale Medical Center. He's an infectious disease expert named Dr. James Shepard. And he told us flat out that within the next 10 years, the next decade, he said flat out, before I retire in the next 10 years, I'm convinced we're going to see another one of these. And this is somebody who does work with the WHO and the CDC. And this is his wheelhouse. He does consulting for big companies, I believe the Olympic committees, all of that. So he's really looking at this hard and heavy to see where they are. And it was an interesting comment he made to me. He said at the very beginning of our relationship, when he saw our business plan and saw what we're doing, the first thing Dr. Shepard said was, well, this is a business, that doesn't go away. You're actually reinventing a category that our industry, meaning the healthcare world, has known has been a problem for decades. We knew that if something really serious happened, we might be compromised. And we had all just sort of hoped we just sort of hang in there and nothing would happen. And the reality is it hit, and it was worse than anybody could have possibly expected. I worked in Asia myself during SARS. In fact, one of our board members is former Minister of Health, Tony Clement. He was actually Minister of Health during SARS. And, we both acknowledged with each other that unfortunately, the majority of our society learned nothing from the last one of these. This time it's a little more extreme because this has affected everybody. It's like a 9/11 that life changes forever on the other side of this, as it's behind us. How we go to work, what we do doesn't change, which means demand for masks and shields doesn't stop. But the added part of this is that the way we go about producing them had to change. It was really like a tinderbox. You had to throw a match in there to really do all of this. And you could see it. And the way we interact, for us to get back to normal where airports are packed, because I don't know how else that works, for us to get back to a stadium and watch a ball game, a hockey game, go see a show, the only way that's going to work is new ways of doing it. Does it mean wearing masks every day? Hard to say 10 years from now, but without a question, they will be part of the equation. And new protocols will be part of the equation.
What does it mean to the company? So this press release, and we've talked about masks, but I want to, and what you guys are doing there, but specifically with this press release, what kind of third-party validation of your products is it to get the Health Canada approval? Because I'm assuming you get put through the ringer, right? And that mask you show us, right? It's form cut mask, provides a tight seal to the face, but it's comfortable wear. What does it take to get that kind of approval? And, what should that tell the world about how careful attention you guys pay to product development?
What I can say is the mask that we have is one of the very few that's made in Canada that has Health Canada N95 certification. It's a very strict process. And one of the reasons why is because it's absolute. And what makes an N95, it's sealed. No air gets in. And then it's absolute confirmation that it's at least 95% of all particles are filtered. Now, the actual independent lab reports we got were better, but we passed the N95 requirements, which was the key, okay? But it is that true certification. It's arguably the most sought after and most copied and fraudulently copied product on the market.
Oh, yeah.
Without question.
People were sewing these things at home for the love of God. People were making them at home and in basements and things like that to sell to people. So yeah, it got, but that's great third-party validation that you guys are making product that can pass rigorous regulatory demands.
Well, what's really depressing, as a taxpayer, is how much money our government spent on fraudulent materials.
And usually I'm a big critic of government, but there's no faulting them this time. I mean, demand went parabolic. People needed it. If you had to run over, you almost had to run over yourself to get this stuff, right? But now that you guys have come along, hopefully this is going to be a much more, intelligent process and much more credible process. By the way, devil's advocate, margins. obviously making masks in Canada means you've got a higher, not obviously, but I'm assuming with 99% certainty, you got a higher cost.
Mhm.
Are you able to pass that cost along to hospitals and Georgecom Corporation and so on and so forth, or you just have to live with making lower margins?
There's definitely a premium that people expect because it's domestically made, but a couple things come into play. Because of the bad experiences the last 12 months, we have the reaction has been, at least I know where it comes from. I know it's safe. I'm willing to pay for that. And it's not like we're such a premium that it's outrageous. But look, part of what got us here is that whole, low cost mentality. I'll give you a really good example. I was in chats with a big hospital chain in the States. One of our contacts there was, a really nice fellow who had been just like everybody else, panic buying because he didn't know what else to do because he couldn't get stuff. And this is really in the dark days a couple months ago. And I said to him, well, our mask is finally ready. We passed ASTM level 3. The factory up here in Canada is ready to go. And he said, well, that's really great. I can't talk right now because I'm in the middle of going through with a metal detector all the masks we just bought, because we just bought 1 million boxes. And we can't figure out which ones have nose clips and which ones don't, because some don't. And the surgeons can't wear them. And I said, where did you get them? And he says, well, that's the problem. We don't exactly know where they came from.
Oh my goodness. What a
And he said, but I'm going to be calling you back for replacement. And I said, thank you very much. I'm here to help. And certainly just give me some warnings so we make sure we have production ready and we can line up materials. And then he said to me, okay, so by the way, you had to be price competitive with what I just bought. And I said, well, isn't that what just got you in trouble?
Yeah.
And the
Some things you can't pawn off as to the lowest cost producer, right?
And his answer was kind of a bit of an expletive. Right, you're right. Call you back. And he hung up. And he did call back. So that mentality is starting to change. We put ourselves in a really tough spot. On the materials side, building domestically gets us out from under that. And the net effect is, for a modest premium, is it worth it where you know exactly where it came from? If it's actually certified, it's actually going to be safe.
Yeah. Yeah. By the way, can people like me, individuals, get hands on your products, or this is strictly B2B application?
We've been B2B, and we're actually getting ready to do a B2C. Our primary goals with this, George, out of the gate were to really fill some holes where some help was needed. Maitri's whole philosophy at the very beginning of this, and Maitri, just understand where the name comes from. It actually means compassion in Sanskrit. Is the company was actually founded out of act of compassion originally. So originally we said, let's go address some real things, because there's some real needs here. One of the exciting things about my career, where I am now in this business, is that I get the opportunity to build a fantastic business coming in on the right side of some real needs. And to me,
that double bonus, right? That's a double bonus there. That doesn't happen very often. You're helping, you're contributing to the health and welfare of society and building shareholder value.
I'm entering a system that was in dire need of modernization. It's been decades in the making, where the position that we're in, and modernization, not only on how materials are produced, where they come from, and all of that, but then also how they're used and how people interact with one another. We were definitely due for some disruption, and that's what I brought to the table. But I get to do it really for the betterment of all of us. Now when I go to a hospital, I know it's safe. And the cool thing about all of this is when we show people our product, they actually say, hey, I want one of those. So that's nice.
I do. When I saw that 3D mask, I call it your 3D mask. I loved it. I do too. And you know what? I was actually thinking to myself, Agoracom's got a lot of clients, and corporate gifts usually are send a gift basket. And I always hate that. It's like, all right, I'll send a gift basket, but I want to send them Maitri stuff this year, and say, look, here's a few boxes of the mask. Here's some shields, and on me, and as appreciation. And if you like it, just keep ordering from them at the same time. But I can't wait to get the mask. So when you have your B2C up, I can't wait to have the masks here so I can show everybody, because I know they're going to love them. The biggest complaint everybody says, it's on their face and they can't breathe, or they can feel the condensate. It's a horrible experience, right? So you guys have done great things on that. And I know you couldn't talk about it, so I can't wait to have you back to hear more about the innovation that's going on, the tech side of stuff, because that's really cool as well, Andrew. Congratulations on what you guys have achieved.
Thank you. It's really exciting times. And it really is gratifying to be doing some of the right things for our society, not just building a business. I came out of the tech industry for the last 20 years. I went around the world and helped people watch pay TV, and people were pretty happy with that. But I wouldn't say I contributed nearly as much as society doing that as I have with this. There's no plaque waiting for you saying this individual, helped people watch more pay TV. I don't think that really exists anywhere.
Well, it did help. It did help a lot of us. Trust me. You brought great content to us, but this is going to be a little more impactful.
The last 12 months, maybe that's right.
Thanks, Andrew. Can't wait to have you back.
Thank you. Thanks for having me.
For everybody at home, you've been watching or you've been listening by podcast on Spotify, Google, Apple, or your favorite podcast platform, to Andrew Morton, CEO of Maitri Health Technologies, trades on the CSE, on the stock symbol MTEC, and for our friends in Europe on Frankfurt under D84. It's a brand new company. Well, it's a brand new industry, right? This is a brand new industry. So there's a lot to absorb. To do your due diligence, get to Agoracom, get to the Maitri Health Hub, the profile page. We've got it really neatly laid out for you in layman's terms, all the different aspects of what the company does. Then from there, link over the company's site, and you can see the link right over Andrew's head as we're talking as well, but you can link to it from Agoracom. Do your due diligence. Hopefully discover the next great small cap company. See you next time.